Welcome to ECANA Learning Lab. This presentation is brought to you in part by AZI.
Hi, everybody. Welcome to Building Trust and Understandings in Clinical Trials Part 2. If you missed Part 1, don't worry. We covered clinical trial basics and a brief history of medical distrust, but you can find the recording in the Learning Lab on our YouTube channel. So before we begin, I'd like to thank our sponsor, AZI, for supporting this series. Really couldn't have done it without them. Today, we have the honor of hearing from two endometrial cancer survivors who have either been in a clinical trial or used experimental cancer drug treatments through compassionate use. For those unfamiliar, compassionate use allows patients to receive promising but not yet fully studied or approved cancer therapies when no other treatment option exists. Our panelists are Stephenie Black Grant and Charmaine Rock. Stephenie and Charmaine, please take a moment to introduce yourselves, where you're from, where you were in life leading up to your diagnosis, and finally, what your diagnosis experience was like.
Okay, I'll go first. Hi, I'm Stephenie Black Grant. I reside in Orlando, Florida. And when I was diagnosed, it was December 2019. And leading up to that, I had about a couple years of having symptoms. And my symptoms were like spotting, my periods had become irregular, I had abdominal pressure, I had pain with intercourse. Um, and I honestly was chalking it up more to like change of life issues because I wasn't having like severe heavy bleeding. So, my doctor primary wanted me to get a pelvic exam because I didn't have a regular GYN at that time. And I kept putting it off. I was real busy with life stuff. Life was happening. And I said, I'm going to get it done. And when I finally was able to clear time to get examined, I thought they're going to tell me I need a hysterectomy, no big deal, and I'll be okay. Well, I got with the GYN and she was very alarmed at what she could feel during the pelvic exam. And so we did a uterine biopsy that day in office. And a few days later, I got the results that I had cancer. So it was uterine cancer or endometrial cancer, properly termed. And that's how all that happened.
Hi, my name is Charmaine Rock, and I reside in New Orleans, Louisiana. Um, the way I started was I was having a pain in my left side, and it was a pain that would come and go. When it came, I would take a couple of Tylenol. It went away for a while. It would come back. I would take more Tylenol. And at the same time, had a brother in the hospital who I was supporting who had COVID. Um, and he passed away. After he passed away, I think the same day as the funeral, the pain was so intense. And I just thought maybe it was stress from that, and going forward. It was sort of like I was taking Tylenol constantly. Every 3 or 4 hours, I was taking Tylenol, and I was thinking, this is not right. So I made an appointment with a doctor, and she recommended that I undergo a biopsy. And as a result from the biopsy, it showed that I had cancer. And she referred me to a gynecologist and oncologist. And she said that, well, it was determined that I had endometrial cancer stage 1B. That's how I found out that I had cancer.
Thank you both so much for sharing. So, how were both of you introduced to the idea of participating in a clinical trial or using experimental clinical drugs?
Well, my doctor, after one of my follow-up visits, um, asked if I would join a clinical trial. Um, she said that this particular trial that she was telling me about was showing great success for endometrial cancer patients. So I took some time, and I told her I was thinking about it. And after giving it some thought, I decided to join the trial because I thought maybe, it would help me. Um, and if it didn't help me, maybe the results of by me participating, it would help others.
And for me, when I was originally diagnosed, I went through like the standard of care for EC. I had surgery, um, and that's when I was stage 3 C1, which meant that they found cancer cell in lymph node. I followed that with 6 cycles of chemo, carboplatin, and paclitaxel, and then I followed that up with 5 weeks of radiation external, and then I did 2 internal radiations. Then I was NED for a year. So in November of 21, I found a lump in my neck. And I had to come back home because I was in Iowa taking care of my dad. So I had to come back home. They did a CT scan and found that it was cancer. So then I had to do a biopsy on the lump in my neck, and it was confirmed to be EC. So at that point, my GYN oncologist, she said, we're looking at your tumor profile. And she said, there's some new therapies that are just coming out. So she's like, I'm going to see if you are a candidate for one of them. And I said, great, because chemo was really hard on me. So I was really dreading the thought of going through chemo again. And so she came back and said, we want you to see the radiation oncologist, but we would like to pair up radiation on the tumor in your neck along with, she said, immunotherapy. And I said, okay, what's that? And she was explaining to me that it was a new medication that was originally approved for lung cancer, and it was in process of being approved for uterine cancer. And so I was like, okay. She said you would get infusions every 3 weeks. She said, but once we confirm what you're compatible with, we would like to go with that. And she said, there's side effects, of course, and she was explaining side effects of immunotherapy, but she was saying compared to the chemo and the type of severe side effects I experienced with that, she said it's very unlikely I would have those types of experiences. She was like, but so it should be more tolerable, is how she put it to me. So I was like, hey, I'll do whatever, because my tumor was growing really rapidly from the time I noticed it, which was November 21, to the time where they were prepping me to begin my treatments. We're talking January. I had got to the point where I couldn't lay down anymore. I could barely speak. I was on morphine for pain. I could barely drink. I could barely eat. So, there was a great concern of me being, not being able to breathe, all this kind of stuff. So I was just like, I don't know, I was just amazed and really afraid because this cancer was growing super, super fast. So I had got mapped for the radiation, and the plan was radiation and then do the immunotherapy. But because of delays from COVID related stuff, if you remember, everybody was waiting on their tests and there was all these delays. I couldn't get started on the radiation. So my GYN onc said, you can do that at any time. We're going to get you started ASAP with the immunotherapy. And so I said, okay. And I went in, got my first infusion. It was very quick compared to chemo. From start to finish, including labs and getting the infusion, I was out in an hour and a half. Compared to chemo, I would be there for about 5 hours. So I was like, okay. And within a couple of weeks, I was noticing a difference. I didn't need to take the morphine. I was down to taking just Tylenol for pain. So I ended up not even doing the radiation, you guys. I just went with the immunotherapy. But that's how it was introduced to me, that it was new. And I recognized the name, the brand name, because I remember seeing the commercials for it. So I knew it had been around for a while, you know. And so I was really excited that I was going to have an opportunity to use something that has been proven to be useful for a different type of cancer. So I was very optimistic.
That's so great to hear. Thank y'all again for sharing. And I just wanted to ask, was there any hesitancy or any fears at all about taking that on for either of you?
I was a little fearful because I didn't know what to expect. Um, but once um, I spoke to the research team, and I guess they explained everything. Um, it was, I felt comfortable, stepping out doing this.
For me, I was a little nervous, but I was more afraid of if it didn't work. Because honestly, in my mind, now this is just me analyzing what I went through. I've already gone through chemo and I've already done radiation, and the cancer still came back. So, in my opinion, the chemo didn't work. So, I was like, they might have to use a different type of chemo on me. And I got a lot of neuropathy. I had a lot of pain and stuff with the drug. And so I was thinking, am I going to have to do that again, and maybe more cycles or more tighter frequency? I was just dreading what that would be like. So I had more optimism than fear. Of course, the side effects, you know how they rattle off all the things that can possibly occur. And I did get a lot of side effects from immunotherapy. But for me, I'm still here, and that was the goal. So that outweighed any apprehension that I might have had towards doing a new drug.
Thank you. And what was the experience like telling your support system about making that decision?
Uh, well, for me, it was kind of interesting because you know cancer care is so complex, and my husband, he was right along, like he was following along pretty good, but trying to explain it to others, it was kind of like a little over their heads. And for me, luckily I could say, hey, do you remember this commercial? That's the drug that they're going to give me. And they're like, oh, okay. So I think that kind of calmed down any fears. And most of the people that I've talked to, they were very supportive and excited that there was an option of something that was new.
So unlike Miss Stephenie, um, this was during the time of the pandemic for me and my family. And basically, I have brothers. I have one sister, but my brothers, I have six brothers. Um, I'm the only one in Louisiana. My brother, who was in Louisiana, passed from COVID. So I didn't really reach out to tell them about it. I think I basically talked to my really close friends. Um, but when it came down to it, the final decision was from me. Um, and the difference is, like with me, I had a total hysterectomy, and the doctors stated that they had gotten all the cancer. So um, doing this would prevent the cancer from returning. Unfortunately, that didn't happen for me, but the support I got basically was from friends who were here, with me. And, they encouraged me, because they say, well, what if there's this chance that, it's going to help you keep the cancer, from coming back. And I told, I spoke to, a couple of my brothers after the fact.
Mhm. And can you speak a little bit more about your experience with actually partaking in the clinical trial? And Stephenie, you spoke to it a little bit more in your last answer, but is there anything else that you'd also like to share about your experience with the compassionate use clinical drugs?
Well, I have to say, I really didn't fully understand that that's how it was given to me until last year. And I have to give my GYN oncologist all her props because she really stays on top of what's coming through the pipeline. So even though it was like, hey, I got this lump, and boom. I mean, she was working on it, trying to figure out something. And when she gave me the medicine, when I started it, it was February of 22 is when I started that therapy. And I did it through December. But what I found out was they didn't get all the signatures and everything. It wasn't officially approved until March of 22. So her asking about it and getting it set up, she started that in January to get that ball rolling. And just to say that, to know that she was working that hard for me. I mean, I knew she was working for me, but it just brought it home when I found that out last year. And she's like, you know, the goal is for you guys to live. We need you to live. And so, yes. And so I just feel very fortunate that she was that aggressive on my behalf. I also have to thank my radiation oncologist because, um, when we talked about me not doing the radiation, of course, he was reviewing my scans with me, and in the end, he agreed that I probably didn't need to do it because it was very evident that the medicine was working. My tumor was shrinking rapidly. Uh, but he was like, cautioning me about these new meds, how sometimes they work for a while and then they no longer work. So he was just, reminding me to stay vigilant, come to all my visits when I'm in surveillance. He was already predicting that I would be clear of the cancer. He was like, just make sure you stay up on your surveillance, pay attention to your body. And if you notice anything, any lumps, any bleeding, wherever, you alert us right away. But he was very supportive and just, was reinforcing certain things and just reminding me that I'm my best advocate. So that's all I have to say about that.
Yeah. Her experience was so different from mine, um, because I dealt it. Well, whereas she, dealt with her doctor, I dealt with a research team, and it seemed like what I went through was so cut and dried versus what you went through. I went there, you know, talked to the research team. Um, they went step by step, this is what's going to happen. And it did, you know, um, it was intravenous. It was 30 minutes. You take your vitals before, you take your vitals afterwards. But at the same time, they observe you. So after my treatment, I had to sit there like 30 minutes, to make sure that I was okay. I wasn't having any side effects or anything before they would discharge me to go home. But her experience was so much different from mine. It's almost like I had a normal, it seems, I would say like a normal experience where you go into a doctor's office, you get you see the doctor, you get your treatment, and you go home. That was my experience.
It's very interesting to see the juxtaposition between those different experiences.
Yes.
Thank you both again for sharing. I do want to take a second to pause on our questions and turn it over to the audience to see if anybody with us today has any questions they'd like to ask.
I think we are familiar with what side effects look like for like chemo. And Stephenie had mentioned about having side effects from immunotherapy. And Ms. Charmaine, is it much different from those that you experience with chemo, and in what way?
For me, the immunotherapy, I had a lot of side effects, you guys, and that's unfortunate. I'm probably a little bit more sensitive because I have allergies. I'm a type 2 diabetic. I have psoriasis, so I already have like immuno issues, right? But I experienced a recurrence of my IBS, which actually I experienced with radiation, right? So, and I still deal with it. It's slowly getting better, but it's still an issue. It's not even close to being gone. It's still something that I deal with. I didn't get like pain with immunotherapy. I suffered a lot of tiredness while I was on treatment. My energy level was very low. So to me, in that respect, I know I experienced that with chemo as well as the radiation. I had low energy. Um, my blood pressure went up, and I still deal with that side effect. So I have to take more medication to handle that. My thyroid, my immune system attacked my thyroid. So I have thyroid medication that I take, and I'll be on it permanently. I'm trying to think. There's so many things. And then just my like skin allergies, that kind of thing. It's much more intense. Like I got bit by, I think, a mosquito. And my hand is still red and puffy. It's getting better, but it was hurting up until a couple of days ago, like extremely painful. So I have to be more careful when I'm outside, if I'm doing yard work. I just do things to take precautions to try to minimize me getting a bite or coming in contact with weeds that might aggravate my skin. So those are the main. It's a lot of stuff, but I still wouldn't trade it because the alternative is probably me dying, and that's just the reality of what we're dealing with. And so I'm glad I'm still here, and I'm glad that I have tools to try to help me manage most of this stuff, so I can still live my regular life.
I had very few side effects. The side effects I had was really, I would get a slight headache every now and then, and diarrhea. So, and I was tired a lot of the times. Um, you know, I couldn't eat spicy foods. There were certain medications I couldn't take. Um, my blood sugar increased. Um, now I have that's pre-diabetic, so now I am on medication for that. Um, but otherwise, at each time that I did go for treatment, they I had a survey that I had to fill out about the side effects, or if I was having or if I wasn't having any side effects. That was each time I went for a visit. So it wasn't, it's bad, but it wasn't so bad.
I wanted to add
Um,
one more
S-
thing though to that.
Stephanie, can I ask you a quick question?
Oh, yeah, go ahead.
I wanted to ask you, I know you said it was on your throat or
Hmm.
your neck.
It was in my neck and my supraclavicle lymph node. So the cancer had spread through my lymph node chain. So remember when I had my surgery, they found the one lymph node that had cancer. But evidently, when I went through treatment the first time and went through the chemo and the radiation, just didn't get all of it. It probably had already begun spreading through my lymph node chain and probably was out of the proximity of the radiation. That's what my radiation oncologist explained to me. And I actually had two other tumors that were like right behind my heart, but they were very, very small. And the radiation oncologist was explaining that more than likely those cancer cells were somewhat in the field of the radiation, like right on the cusp of the beam of the field that they treated me, whereas my neck was not radiated at all. And so those cancer cells were just growing freely. So that's what that happened, but it was through my lymph nodes.
If a person looked at you, just looked at you,
Mm-hmm.
could they see that, or is it
Oh
something you
yes.
could feel?
When I felt the lump, I was sitting with my dad. He was in a rehab center from his own illness, and I was wearing this turtleneck. I'll never forget it. And I was scratching my neck, and I thought I was scratching my collarbone, but I saw myself in the mirror, and my hand was up here, and it felt hard like a bone. I could tap on it. It kind of it sounded and felt like you tap on your collarbone. That's what it felt like. And when I tilted my neck, I could see a little lump. And first person I called was Adrian. She's on here. And it scared me because of course I'm Googling hard lump. But when I pressed on it, the pressing on the actual lump didn't hurt. What began to cause me pain as it grew was it was pressing on the nerves in my neck. And so I was having shooting pains down my arms and all this stuff. And then it was pressing on my vocal cords and pressing on my esophagus. So that's how it began to interrupt all those things. But by the time I got to treatment, the mass was over 5 centimeters in diameter. So it was like a big giant egg. And I mean, you could see it from across the room. It almost looked like a goiter, maybe. That's the best thing I could compare it to. And when when I went in for the second treatment, so 3 weeks later after first treatment, you could barely see it. And the nurses were so excited. The staff at my clinic was so excited, and I couldn't wait to show my doctor. And she comes in with her laptop, and she's all business, y'all. So she's asking me all the questions, and she's just typing away. And she's not looking at me. She's just typing and just asking me all these things. And she says, "Okay, let me examine your neck." And she turns around and she looks at me, and I'm wearing something that's like got all this exposed so she can see. And she almost fell off that little stool, the stool with the wheels on it. She fell back like that, and everybody was in tears. And I said, I know we have to be, limited in our optimism. I said, "But this is working." And she was like, it is. And we were just crying and laughing. And, I'm getting emotional thinking about it now. But that's what it was. And I have to say that the way my treatment was administered, I had cycles every 3 weeks, and I did 6 of those. And then I did 2 more cycles that were every 6 weeks. So they doubled the dose so I could skip. And when that happened, that's when, actually, no, it was three times I did that. When I did that double dose, that's when I really experienced the increase in the allergies. That's when my blood pressure just really spiked. And I didn't do any other therapy other than the immunotherapy. Now, what I'm finding out is they'll give immunotherapy along with a chemo, but I'm sure the dosages probably are different. I was the first person at my doctor's clinic to do immunotherapy. So I very much, even though I wasn't in the clinical trial, it almost was like I still was, because they're looking really hard and seeing how I react to all of this. So that was interesting once I really processed that. It's like, okay, yes, they're they're kind of like seeing how this goes. Okay.
And
Let
then
me say that Stephenie and I had two different drugs. She had the brand drug, whereas my immunotherapy was the generic drug for my immunotherapy. I don't know if there's a difference um, between the two.
Tiffany, would you actually like to speak to that?
Right. So for those of you who aren't familiar, every drug that gets approved, of course, when you see those commercials and all of that, those are the brand name of those drugs, but they all have a generic name, which is the chemical makeup of that drug. And so sometimes people can get caught up in the name, but if it has the same chemical makeup, it has the same mechanism of action, how it reacts in your body, and it does the same thing. And so this is a really good example of how a generic versus a branded drug does the same. That does the same thing. So I hope that answers your question. But that's a very good example about generic versus branded drugs. And honestly, the only thing that changes, literally everyone, because I have a background in clinical research, is you can have a drug called ABC123. The moment it gets approved by the FDA, it will have a brand name. It is still drug ABC123, just with a new name and pretty packaging. So that's one thing too.
So the generic name that I was taking, it was pembrolizumab. Am I saying that correctly?
Mm-hmm.
Yeah.
Right.
That's the generic. That's the name,
Right.
not the brand name.
Oh, well, we had the same drug. Okay,
Okay.
that's what I had. Yeah.
Mm-hmm.
And there are other immunotherapy drugs. I can't remember the name of it, because there was another one that they were considering. But with the pembrolizumab, my tumor marker was protein deficient. It was really, really, I think, is it deficient or high TIF with pembrolizumab? But whichever end it was, I don't have my notes with me. I'm sorry, but I was like way high on the chart. So it was a very good indicator that I was a great match for that immunotherapy drug. But the other one that was coming out that would have been available for me, it was the opposite. Like, it was the opposite end of the spectrum, and so that wouldn't have worked for me. And I can remember my doctor telling me that the other drug wouldn't work, that it would it make me sick for no reason. Like, I would get side effects for a drug that would not work for me. And she really had to explain it to me, because at that point, I was just like, I don't care. Give me all the drugs. Like, I was so scared. I was so scared. So I was like, I don't care. Just give me the drugs. I'll deal with the side effects. I didn't care. She was like, no, Stephenie, this drug, this one that we're not going to do, this is what your tumor's doing. This drug doesn't work for that. And she had to really like hammer that to me. I was like, oh, okay. She's like, but this other one, this pembrolizumab, she's like, this is a very, very high match for you. So we're going to, we're very fortunate that this is available. So I was like, okay. So that's how that went.
Thank you so much again for sharing. Were there any other questions from the audience?
So Leah says, thank you both for sharing your stories. Her question, did you have any initial fears regarding the immunotherapy? And did those fears dissipate as you continued the treatment?
For me, I really didn't have many fears about it. From what I understood, immunotherapy helps to charge up your immune system so it can, fight the cancer and inhibit some stuff on the cancer cells so that it can be detected by your immune system, so your immune system can kill it off. So I was like, wow, that's pretty cool, you know. And so I was excited about it. I kind of felt like, and I don't know if I was misguided by this, but I kind of felt like maybe it won't be as toxic as the chemo was in my body. That was how I looked at it. Um, yeah, so I wasn't really afraid. And I was familiar with infusions, of course, after doing chemo. So, you know, they accessed my port and it was every 3 weeks. So that was nothing new, you know, getting the labs before you do treatment, that I was accustomed to that. So, you know, dealing with the side effects when I started to deal with them, um, it was, you know, things definitely had to be done. My primary doctor was like, I was working her because my thyroid levels was crazy and, you know, my blood pressure and all that. And so, you know, it was interesting to hear a doctor from that standpoint because, you know, she's worried about my whole health. And she was like, yeah, they do this stuff, but then we got to adjust all these things. And, you know, she's an internal doctor. So, I mean, she was doing all the things. And so it was just interesting, like seeing that side of it. But she was definitely excited that the drug was working and that, you know, even when I finished, even though, like I said, still dealing with the side effects and, you know, things starting to get a little better, but I still am on a lot more medication than what I took prior. And that's probably going to be my reality for a long time. But yeah, I wasn't like my greatest fear was dying. So um, that outweighed any fear about trying a new drug.
I wasn't fearful. I went in thinking, hopefully it works, but there's always a chance that, it won't work. Um, what happens if it don't work? you know. But I had already decided within myself, it's gonna be what it's gonna be, So I'm gonna accept whatever results come from it. That was how I took it because I mean, I was already over 60 years old, you know, and I looked at it like I've enjoyed my life. If it's for me to continue, I'm gonna still be here. I'm still here, you know. So it was all good. It wasn't I wasn't fearful. It was just a little scary. That's it. But I got over that fear, you know.
Kudos to you both.
Yeah, thank you guys
Seriously.
for answering that.
Okay, great. I did want to ask, even though Stephenie, I feel like you had such a positive experience, and I really love that.
Yeah,
It
really.
feels so reassuring. Yeah. But I did want to ask, was there anything that you felt like could have been done to improve your experience? Either one of you.
I don't think for me, I mean, Stephanie's situation was totally different from mine, and I feel like when I went into the situation, in remission. Um, I was hoping to come out, of the situation
I
still in remission and to stay in remission.
Right.
That didn't happen for me. But I think the overall situation for me, um, the process, I don't think there was anything different, may well, I don't think anything different, could have been done, because of I think of I was already at that. that stage?
I think for me, I wish I had like more information about the drug, like people's experiences. Like maybe I wish that my doctor could have said, "This is like these are some testimonies of like what just like what you guys are doing here." I don't know if they do that with clinical trials, like get people's testimonies after the fact or what, but maybe share that kind of information because um, I knew I was the only one, or the first one, I should say. I don't know if I was the only one by the time I finished taking the immunotherapy, but I knew I was the first one at that clinic doing it for EC, and I was the only one. you know, um, so it would have been nice to like get some more information like that from people that actually use the drug. I think that would have been helpful, and maybe would have like prepped me for more for the realities of what the side effects might look like. Because initially, it took a while for those side effects to start hitting me. So at first I was like, oh, this is a piece of cake, like, then I started getting more tired, and then I started noticing, well, they noticed my blood pressure was going up, and then my blood sugars were going up, and like, yeah. So, and then when they started the double dose, then it went like from like this to boom, like everything. So, you know, um, I think something like that might have been a little bit more helpful, but I don't think it would have steered me away from trying it, from doing it. Again, I was this to me, it sounded like it was my only hope. So,
Thank you
I
both so
think
much. Oh,
that's
sorry, go
one
ahead.
of the things is that, they tell you about the side effects that you may have, but they don't tell you like um, what encounters, what other encounters, other encounters you may, what other things you may encounter. Like she had issues, with the blood pressure, with her thyroid and stuff like that. Um, that is the only thing, going into that. You may have some things, um, and I guess, well, if you like me, I didn't even, that's something that I never even thought about, but it did, I know, raise my blood sugar, you
mm,
know. Um, so I think, those are some things that they should add to the list, of side effects to tell you that, this may happen to you, or, if you're on this medication, because they do ask you, if what type of medications that you are on, and then tell you that, it may affect, those areas.
right.
Mm,
And I think too, like, because I had the comorbidities, right? The type 2 diabetes, and my allergies and psoriasis and all this stuff. So, um, it would be nice if that kind of stuff was addressed more. And I feel like our community, a lot more people are afflicted with, especially the type 2 diabetes, high
And the
blood
high
pressure.
blood pressure,
So
yes.
I think that that's important, and it, should be pointed out so you can be more proactive about, you know, monitoring those things, and trying to keep them within acceptable ranges, rather than reacting. You know
yeah.
what I'm saying? So I don't know, and maybe they're doing a better job with it now. Like I said, I know that I'm the only person. When I talk to people that I have met that have done the immunotherapy, they don't take it quite the way I did. They take it in combination with another therapy, and that's not what I did. So,
But still, in all, creating a more, I guess I would say, well-rounded treatment plan.
right.
Mm, thank you. Very informative. And then what, if anything, do you feel like you learned from the experience? And it doesn't just have to be around endometrial cancer or the treatment, it can be about yourself as well.
I guess for me, and it just reinforced that, one system in your body, it doesn't operate alone. Everything kind of affects everything else. That's the biggest thing I could say I've learned from going through all of this. And I will say too, I learned that even though I can be kind of like assertive, I think my dad is on here. He would attest to that. When I really want something, I can push for it. And when I was going through cancer, through the first treatments, I just was doing as told, right? I got my treatments, I had my surgery, got my infusions, and got the radiation. And when it came time for recurrence, and like I said, when I noticed that the medication was working and I hadn't yet had that first radiation, I was like, I don't think I need this, and I recognize that I still have power and input over my cancer treatment, and my opinion is valuable and holds weight. I remember that because, like I said, the first time around, I was just doing as told. I was following the plan. This is what y'all say, okay? And I didn't question it. And not that I really was like trying to question it, but it was just like, this was obvious. And I'm like, y'all map these tumors for a reason before you give radiation. So how are you going to give radiation to an area that now is no longer the same size and shape that it was when it was mapped? And so I was like, till we see what's happening, I think we need to hold off. And so fortunately, I didn't have to do any radiation that time. And should I ever have another recurrence, I still have option for that if it's, in an area that can use it. So I'll just hold off, and, if I need to do it in the future, so be it. But, just remembering that I have input on this, just like I have input on anything else that's going on with my body.
Well, I learned how to advocate for myself. I learned how to ask questions because, like Stephenie, well, I think I was still in shock in the beginning, you know, um, but I learned that I was a strong person. You have to be in order to go through this. You learn who your support system is. You learn who stands by you. You learn your value. And I'm good. I'm happy. Like Miss Stephenie said, I'm still here.
Yep.
And if I go tomorrow, I'm happy because I beat this.
Right.
That is so beautiful. Thank you both so much. We're getting down to the last few questions. A lot of it is centered around the advice that you give for someone considering to participate in a clinical trial or perhaps utilize an experimental clinical drug. What advice do you have for someone in that position, especially within our community, within the Black community?
For me, I would say make sure that your literature that you give to patients that might be participants, give them stuff that, shows that you are considering our community too. And if you've only considered one demographic, if only been able to test so far one demographic, show that too. Like, just be transparent about those things. And maybe like something like maybe holding like an informational or something, like attend our health fairs. There's all these Black Health Matters. People, most of us have heard of that organization, but churches host a lot of health fairs and community fairs. Like, go there and set up a tent, or a table or whatever, and talk to people about, the things that you're doing and, how that affects and helps people in our community. I think really showing that you're trying to help all, everybody, not just the majority, I think that would be really helpful, just to give more information, like make them more tangible and available, because in my mind, before I started doing all this, pharmaceuticals were kind of like, they're there, but who are they? Where are they? They're these faceless people. Yeah, so just be willing to face the public.
I definitely agree. You have to be within the community. You have to listen to those people, and you have to figure out ways to connect directly. Absolutely.
Mm-hmm.
And then, is there anything you'd like to share, or sorry, anything else you'd like to share, or anything else you want people to know about clinical trials or experimental clinical drug use?
I would just say, make sure if anybody finds themselves doing that, or even if it's not experimental, just could be just regular drug. If you're having side effects, make sure that you're telling your doctors about it, because they're supposed to report that. And even if it's something like you think is kind of minor, like feeling tired, like most people will be like, oh, I feel tired, but they're not going to make a big deal about that. My doctor was very, like, okay, they had like a whole list of stuff. Our experiences, okay, what is this like? Like, she would stop and ask me on all these things. And I was like, I feel like so many things are wrong, and she was like, well, we need this information. So, and it's fine. Like, so I think just remember that even if you think it might be something that's not a big deal, if you realize that it's because you're taking a new drug, let your care team know, so that they can report it like they're supposed to.
Charmaine, any last words from you?
No, I think she said it all.
Look, y'all,
But
I wrote all my answers
I would
out.
also, I'm sorry.
No, you're fine. You're fine. Go ahead.
But I would say, I think, you're participating in the trial. You're volunteering your time. So if you're uncomfortable with that, don't be afraid, to tell them that, you want to drop out, that it's not for you, and make sure that, you look at the way that they treat you also.
I really appreciate you sharing that. I think it's really important for people to know it is 100% always your choice whether you decide to continue on with a clinical trial or experimental drug use. Um, it is your life, it is your body, it is your choice. But thank you both again. Oh, sorry, Tiffany,
I
did you
just
want to?
wanted to add to that because I love that you said that, Charmaine, that you can stop participating at any time. One thing I will say that's important is if you are on a trial that has an investigational drug, you do want to, like Charmaine said, ask questions. So if you want to go off a trial for whatever, like if you just don't want to go to it anymore, like, girl, I'm over it, you have every right to say that, and that is your reason. But you do want to make sure that how long does this drug stay in my body? Like, how long should I check for any side effects? Because sometimes what they'll do is they'll ask you, even if you withdraw, we're still going to ask you to come back in 30 days, right? Or 60 days. That may be something that your doctor may ask you to do as part of the research. However, with that, you can also say no to that too. You can. But I would just say to keep in mind when you're doing these investigational drugs and participation, that your safety is the main priority. And that's why we do clinical trials. And so, but you also have, again, every right. And I've seen the gamut of why people stop being on a clinical trial, and that is their right to do so. So thank you all so much. And I'm going to shut up. Keep going.
No, that was fantastic. Thank you so much. And thank you again to our wonderful survivors and advocates for being here today and answering these questions. Yes, please give them a round of applause. They've worked so hard. Thank you so much again. I know it takes a lot to share your experience and share your stories, and you're doing it for such a great cause. So thank you so much.
Well, happy to be part of this. So,
And thank you all for being here today. I really hope you've enjoyed the webinar. And if you missed any part of this, if you want to share it with somebody else, the recording will be up on the Learning Lab on the YouTube channel, I'd say within the next few weeks. I want to give one more thank you to AZI for supporting this series. Thank you all again and have a wonderful weekend.